If you want to walk into your medical school interviews feeling confident in how to answer every single question, then this video is for you. In this, we're going to be looking at COVID-19 as a hot topic so you can understand all of the content that you need to know to be able to confidently walk into your interviews and secure your offers. Hi, I'm Loveleen, a medical student at King's College London, here to help you with your interviews. Now, I completely understand how daunting and difficult interviews were, as I was in your position. But fast forward a couple of months, I went on to achieve all 4 of my offers with interview scores as high as 135 out of 140, and I'm here to help you do the same and achieve your dream of studying medicine. On my channel, I talk about all things relating to medicine, entrepreneurship and mindset. Now, to help you, I've also created loads of different resources. First up is my Aspiring Medics newsletter for completely free resources. On this, I post loads of different tips relating to the journey of getting into medicine, especially around during UCAT season and interview season, and what you can be doing to help you achieve your dream of studying medicine. Additionally, one of the key reasons that I was actually able to get all 4 of my offers was my interview document. This is an over 50-page document in which I've included all of the content that you need to know, ethical pillars, over 100 different types of questions, and also the NHS hot topics and research. If you're interested in this, make sure to check it out using the link below. Additionally, if you want more personalized support with helping you get your 4 out of 4 offers and studying medicine at your dream uni, then check out my interview course. Again, as part of this interview course, you get personalized, tailored learning given to you about all the content, learning how you should actually be structuring your interview responses, what your interviewers want from you when you're doing a med school interview, and the art of speaking and presentation, because this is so important in helping you secure your offers and get into medicine. COVID-19 was caused by the SARS virus and was first detected in China. Now, the virus managed to spread globally due to respiratory droplets and different contaminated surfaces, and this resulted in the World Health Organization, or WHO, declaring a global pandemic in March 2020. The first case of COVID was detected in the UK in January 2020. Within the UK, there were many different public health measures that were used to try to prevent the spread of COVID-19. First was the introduction of lockdowns, and many social spaces were no longer allowed to be used. There was also many public health campaigns, such as emphasising the importance of wearing face masks and washing hands regularly. Mass testing was also rolled out, making sure that once an individual was identified as having a positive COVID test, then they had to isolate and quarantine themselves. There was a rapid vaccine rollout and booster vaccines also offered in order to create that herd immunity, and additionally, those who had lost jobs during COVID often were put onto furlough schemes created by the government in order to still provide financial aid to as many people as possible. Hospitals actually faced immense pressure when COVID began in the UK. Many hospitals were flooded and overwhelmed with a vast number of patients, and typically PPE, personal protective equipment, ran low, as did ventilators. As COVID affected the respiratory system of many people, ventilators were often really important to use, but again, there was a shortage of these. Additionally, the staff who were on the front line of doing this were also at danger, typically when PPE supplies were running low. This meant even NHS staff were actually not able to always protect themselves at times. During this time, the importance of collaboration was highly emphasised, and the development of Nightingale hospitals occurred to help support hospitals. This was one of the solutions in order to try to create less workload and in order to actually help hospitals with the immense number of patients that they were seeing. Nightingale hospitals were essentially another area where COVID patients could go to make sure they were able to still receive healthcare treatments. COVID had many negative impacts. One of these included insufficient bed space. Now, due to a significant number of patients having to come in because they were infected with COVID, this meant that a lot of areas within hospitals also had to be converted in order to cater for COVID patients. As a result of having to cater for COVID patients and prioritise these during the pandemic, this meant that there was a significant backlog created in secondary care. This means that patients from lots of other specialties and departments or other non-urgent consultations were often cancelled, unfortunately, and this has now created rather long waiting lists and has created a backlog within the NHS. Many studies have also been conducted that unfortunately show that there was a significant increase in poor mental health, especially during COVID, and there's a number of reasons for this. First include the stress and anxiety that was often experienced by families who may have had relatives in hospitals. Due to COVID, many families were not able to go and visit relatives in hospitals, creating that stress and anxiety. Additionally, within healthcare workers, there's significant stress and anxiety too, especially when there were shortages of personal protective equipment. This meant that many healthcare professionals often felt stressed and worried that they were not able to adequately protect themselves from the virus, and this actually did increase infection rates among healthcare professionals too. Additionally, many students had to switch to online learning, as this is what schools and universities did, but again, this had a knock-on impact on the mental health of young people. Children who were often in school, they didn't have that same interaction as they were not in a school environment, and additionally, those who were in higher education such as university were often worried about different opportunities, and again, having having their learning online, they felt that maybe that this was impacting them negatively, contributing to worsening mental health during this time. COVID also had a very economic impact in the UK too. Although the government tried to include different schemes to help businesses and people who had been fired during COVID due to businesses not being able to have a significant number of employees anymore, there was still a significant impact on the economy, and many businesses fell through or employees lost their jobs unfortunately during this time. Although there were many negative impacts unfortunately from COVID-19, there are also some important lessons that were takeaways from this. The first is that it acted as a catalyst for improved mental health awareness. Due to a greater number of people suffering from mental health conditions or mental health problems during this time due to social isolation and being on your own more and not being able to actually be in these social spaces, this meant that actually there's been an increased amount of awareness. This could be beneficial as it helps to reduce any stigma, creates more services for people who can access them, and actually creates more support. During this time, especially in the UK, there was an element of national cohesion and understanding of everyone being there and supporting one another, even though there was still social isolation occurring. Especially in terms of the NHS, there was definitely a growing awareness of the roles of NHS staff and how that they were putting themselves on the front line. They were at significant risk, and this growing awareness has definitely increased the public perception and public understanding of the difficulty of careers in healthcare. Additionally, COVID did accelerate the growth of different technological advancements and the idea of telemedicine. Telemedicine is when different healthcare consultations can actually be delivered over the phone or using technology. This has reduced the amount of in-person GP appointments that have been occurring, which has actually improved accessibility for loads of different patients. COVID-19 had a significant impact across the world, and in this video I've talked you through everything about COVID, the impacts that were both negative and positive, so you can talk about these in your medical school interviews. It is definitely the first thought to talk about the negative impacts of COVID-19 because of how difficult it was, but it's also important to discuss the lessons that were learned during this time as well and how this can actually be beneficial too. I hope you found this video helpful, and if you want to learn more about different NHS hot topics, make sure to check out my other videos on my channel.